the hospital. Ever since the new outbreak of Xinfadi wholesale market in Beijing, the cumulative confirmed cases in Beijing amounted to 335. 324 were now in hospital and 11 were discharged from the hospital. And as to the asymptomatic carriers still under observation, the number is 30. So for 8 consecutive days, the newly reported confirmed cases in Beijing have been kept within one-digit number. As to the cured cases, the number keeps rising up. So this new round of coronavirus in Xinfadi shows features like high concentration. 47% of the confirmed cases belong to the staff members of Xinfadi wholesale market, dominated by Fengtai district, taking the number of 295 and 88% of the total number. And the clinical symptoms of those confirmed cases mainly belong to the mild cases and normal cases, accounting for 98%. According to the small applet of a state council, by July the 5th, the number of high-risk districts in Beijing stand in the number of 1, and the 22 belong to the intermediate risk areas. So, with about 1 month of precise measures in prevention and control, the prevention and control situation in the capital city is pointing up, and it's under our observation and control. But at this critical moment, we must stay vigilant and prevent the transmission from elsewhere and avoid the transmission to the other places. We must put our eyesight on the key personnel, key districts and spaces. We must not let go any one hazard, and we must continue our efforts in improving this situation so that our scientific and targeted measures will perform well in the prevention and control efforts. So Beijing City has been committed to taking the priority of people-orientedness, and people's safety and health have become the first thing in our minds. So we go all out and work wholeheartedly to safeguard the life of every person. And for every confirmed cases, we endeavor to discharge them from the hospital with enough treatment. We combine Western medicine and traditional Chinese medicine, and we manage the whole process of the medical cases. So we have been all out to cure the number of those confirmed cases, and we help them with their rehabilitation. Even with psychological efforts, we have guided those medical staff and the patients and their family members to face this issue scientifically, and we also strengthen the medical services during the prevention and control period so that the medical services will be delivered in an orderly fashion and avoid further infection among the staff members of the medics, and we meet the requirements of those patients, particularly for emergencies. Ever since tomorrow, the Gaokao will begin in 2020. This is going to be a test for the students in their academia, their life, and even in the epidemic prevention and control. So Beijing People's Government pays high attention to this event. The parents, the staff members of the schools must give top priority to the safety of people and make full preparation for this examination. With disinfection and a delicate arrangement, the 14 examination areas and 2,867 classrooms for the examination have been put in place according to the requirement. So we're all waiting for the 49,225 students yet to attend this examination to come. In these extraordinary times, we have extraordinary requirements and measures so as to create a favorable and reassured environment for these students. During this Gaokao period, I recommend our civilians to adopt green transportation and give green channels to those parents driving their kids to the examination spots. And we must do a good job in disinfection so as not to leave one loophole of virus transmission. Today, we have invited experts from Chaoyang Hospital, affiliated hospital, and Anding Hospital, and Beijing CDC to attend this press conference and to brief you about the updates of epidemic prevention and control. Now I'm going to give you the experts and leaders today. They are from Beijing Center of Disease Control and Prevention, Madam Pang Xinhuo. From Chaoyang Hospital, Party Secretary Zhang Jinbao. And Beijing Psychological Intervention Leading Group, and from Anding Hospital, Xi Yingjun. Now let's firstly give the floor to Madame Pang Xinhuo for the briefing of the newly added cases and the epidemiology study results. Dear media friends, good afternoon. Now I'm gonna present to you the situation of the added cases on July the 5th. On July the 5th, in Beijing, we have one added case. As to that case, now I'm gonna present to you the details. It's a female at 50-year-old residing in Huaxiang neighborhood of Fengtai district. He is a salesperson in a fruit and vegetable store, and she has been confirmed as a close contact. And then, ever since, she was transferred to the concentrated observation site for further observation. And on July the 4th, the result of nucleic acid turns out to be positive. And then she was transferred to the hospital and was further confirmed as a normal epidemic case on July the 5th. In the capital city for 8 consecutive days, we have kept the newly added confirmed cases under the one-digit number, so we are turning up. But the risk of transmission of this virus is still here with us, so we encourage the civilians to do a good work in disinfection and sanitation, to keep a distance when you are out, and wash your hand frequently. Do not touch the public facilities. If you have any discomfort, you must go to the hospital immediately. We must avoid any mentality that may lead to further infection. For those suspect cases, close contacts, who have frequented the Xinfadi wholesale market, you must set up a good mentality and report voluntarily if you have any discomfort. As to the epidemiology study results, different public spaces and quarantine places must implement those measures of quarantine. Aside from that, in Bayanar of Inner Mongolia, we confirmed one another case. So I recommend our civilians to do good protective jobs when you visit the grassland. Do not eat wildlife and do not stay overnight on the grassland. If you have fever, please report voluntarily to the hospital about your contacts with those wildlife in order to smooth away the procedure of confirmation. And we, as the medical staff, must pay close attention to the symptoms of the plague and inform the family members of any suspect in order to do immediate prevention. Thank you, Madam Pang, for your report. Now let's turn the microphone to Party Secretary of Chaoyang Hospital, Zhang Jingbao, to brief us about how to do good emergency medical services. Dear media friends, good afternoon. The collective cases in Xinfadi wholesale market have been plaguing us for days, and Chaoyang Hospital put the top priority to the lives of the general public and have been implementing the requirements of Beijing Leading Group of Epidemic Control and Prevention. We have 4 management measures in emergency rooms, and we commit ourselves to the one system. We take the transfers from the other hospitals as well. For the hospitalization and emergency rooms, they belong to 2 different categories of patient admission. And for the pregnant woman, those with chest pains or different injuries, we will offer green channels to the special cases to guarantee that those patients in emergencies could have access to treatment in time. In our emergency rooms, we have accepted 19,000 cases. We have already taken 270 operations with 0 infection between the medics. Firstly, we have a new system in place about classified treatment and diagnosis. They all have to show their APP of their health status, and we also combine the screening of epidemiology. For those patients facing the hazards of their lives, we must offer emergency rescue as well. For the suspect case, we will offer local quarantine, and we will do the nucleic acid testing of that suspect to ensure the safety of those patients under dangerous conditions. For the pregnant woman, those under severe injuries, or the patients that may be susceptible to myocardial infarction, we will also have a whole procedure in place to rescue them. We must work hard to guarantee the connection between different procedures. And as to referrals, we are building our capacity. Firstly, we have boosted our capacity in admitting those emergency cases. We mobilize the resources in our whole hospital and readjust our distribution of resources in the emergency rooms. For those wards that are close to the emergency rooms, they become the transient places to accept those suspect cases to boost our capacity in admission of patients. And as to the observation of those patients in emergency rooms, we have quickened the referral process. We enhance the coordination with the other hospitals. In total, there are 172 beds initially. Then we add another district to add another 45 beds. So for the emergency patients, we have boosted our capacity in admitting more numbers of those patients. Thirdly, for the patients under observation in the emergency rooms, they must complete the so-called 1+3 examination to check their antibody, their blood routine, and their pulmonary examination, and their lung examination. They also have to go through the second round of nucleic acid testing. The 1+3 testing must be finished in a quick fashion, and the nucleic acid testing is done in the emergency rooms. There might also be the option of minimally invasive operations, and for those patients, we must have quick testing and quick result coming out. Fourthly, the green channels. We guarantee the treatment of the pregnant women, patients with severe injuries, or patients susceptible to the myocardial infarction. We are now working with the other departments, like the department of the chest pain treatment, and to work on the patients with different complexities. For example, the chest pain patients, we offer a green channel. The emergency operations to treat those patients with myocardial infarction have been going on. There are 2 channels connecting the emergency room with the catheter room. With the intervention measures, we could complete the entire requirement to offer timely rescue of those patients with myocardial infarction possibility. Firstly, we will have a screening of nucleic acid testing. Then we have the examination in other divisions. For example, we might consider the testing of ECG. For the suspect case, we will offer the CT scanning in the lung. We will also have blood routine testing and the throat swabbing. With those rounds of testing, we might further consider the operation on the heart. For those intervened patients, the hospital will put in place some special quarantine rooms in our wards to ensure 24/7 acceptance of the new patients. For the pregnant woman with C-section, we open our operation rooms to those patients, and we also offer operation treatment and the other green channels to the pregnant women. In addition, to give top priority to those patients under dangerous conditions, we might divert the patients not belonging to this category to reduce their occupation of medical resources. We have a hotline, we have official website, and different registration platforms to put out the information about the rescue rooms, the beds, utilization ratio, and other useful information to divert the other patients. Internet plus medical services are combined together to maximize the efficiency of resource distribution. For the chronic disease, the commonly seen disease, and the returning patients, we will offer the online medical services through the internet. Now, the respiratory department, the internal secretion department, the immunology department, and other 7 divisions, together with their 80 doctors, have opened their accounts online to relieve the pressure on the emergency rooms on site and to avoid the pressure of medical resources. For the next step, Chaoyang Hospital in Beijing will continue our principle of a public hospital and go all out to prevent and control the epidemic while guaranteeing our medical services in order to safeguard people's life and safety. Thank you. Thank you, Mr. Zhang, the party secretary and the council member of Chaoyang Hospital. Now the floor is open to Q&A. Please identify yourself before you raise the question. In the midsection and 3rd row, please.
From
CCTV, my question is to Madam Peng. According to the nucleic acid testing results in Beijing, the quarantine sites in the communities might be cancelled. So what are the details? According to the principles of all those that should be subjected to the nucleic acid testing, now 11 million residents have been tested. We have efficiently cut off the transmission channel to avoid further transmission of the virus. Ever since the Xinfadi incident, for some communities, villages in Beijing, we have locked them down. For the other villages and communities, we have closed them for better stringent management. Now the situation is turning up, as the Xichen, Haidian, and Fengtai districts, including about 54 neighborhoods, we have canceled the management measures of lockdown. For those who have visited the Xinfadi wholesale market, the number has been about 74,000. They have resided in their homes for 14 plus 7 days. That's the requirement of our distancing policy. And for the third round of nucleic acid, if the results are negative, then we might cancel their stay-at-home requirement. And in the next 7 days, ever since the cancellation of their quarantine, they must still wear their masks, wash their hands, and do not gather in the public spaces with their friends, and still conform to those stringent measures. If they discover any further symptoms, they must voluntarily go to the hospitals. For those in collective quarantine sites, the third round of nucleic acid testing results are about to come, so we will continue the precise measures. For those Xinfadi members who have been collectively quarantined, we will gradually cancel the quarantine requirements. There are two situations. One scenario is for those members quarantined ever since they visited the wholesale market, they belong to a higher standard. After the 14 days of quarantine and the test of nucleic acid turns out to be negative, they might be cancelled the quarantine requirement. After all, they have visited the wholesale market, particularly the dangerous section of sheep and beef selling market. If they haven't visited the beef and lamb sales market, we have the other standards for quarantine. If there are no positive cases, after evaluation and review, we will adopt the 14 plus 7 policy. After the completion of the quarantine and the test turns out to be negative, their quarantine will be expired, and they must all sign their names and make promises. In the next 7 days, if they stay at home, they also need to check their situation and must do good protection when they go out. For any abnormality, they must report to the local community. For those collective quarantine measures, we are taking the measures step by step. It doesn't mean that the alert is off and we are back to normal. The outbreak of Xinfadi incident signifies that the city is still under pressure and the risk of epidemic transmission. We must not let go of our vigilance and be consistent with the policy of avoiding imported cases and curb the transmission of local cases. Under the second level of emergency response, we must shoulder our responsibilities on different parties and do a scientific work of epidemic prevention and control so that it will become a routine in our daily lives. And the general public must be active in abiding by this policy. We must join our hands together to win this battle. Next question, please. In the fourth row of the middle section. Thank you. I am from Beijing Media Network. My question is to Mr. Xi. Since you are an expert in psychological intervention, so for the confirmed cases, how can we do a good psychological intervention work? Thank you for your question. Now, Beijing's coronavirus prevention and control situation is turning up. But as to mental intervention, it takes time to deliver effects, particularly for the population under severe affection. Their mental reconstruction may take a long time. In the future, For the psychological needs of different population, we have customized intervention measures to build their mentality and to prevent any further risk. For those confirmed cases, we have the following policies. First of all, with the patients, we could inform them of their treatment options and procedure so that the patients will be fully informed of their treatment policies. And thereafter, they will be prepared for the treatment. Secondly, we encourage the patients to regularly talk with their family members, their friends. Through such communication, they could acquire support from the society, and then they can build their confidence of fighting against this epidemic. Thirdly, considering the special features of this epidemic, we offer a lot of online intervention possibilities. For example, we have our WeChat account to guide our patients to stay mentally healthy. They could scan the QR code and to access the services of psychology help. For example, we have small tests of their mental health status and how to control the pressure. In addition, we have a timetable published to the patients, so we can help the patients to arrange their daily lives. Gradually, they could have a very good habit that is critical. Besides, in the wards, for example, we guarantee the adjustment of the lighting. For example, we will turn down the lights in the nighttime and we may offer the masks so that they could have a good sleep. Last but not least, if we find any emotional change of the patients, like impulsion, we may consider a consultation. We might even prescribe some drugs to the patients. Up until now, in Huilongguan Hospital and Anding Hospital, 4 doctors and 8 nurses have participated in Ditan Hospital's medics for the psychological help offered to the patients. We also have a multidisciplinary panel so as to pay close attention to the mental conditions of those patients. With our follow-ups, we can discover any problem immediately and offer the psychological help. And we will do such evaluation of their mental status on a continuous basis. So that's about our intervention measures mentally to the confirmed cases. Thank you. Last question, please. In the west section, 4th row, please. Thank you. From Beijing Daily, my question is also to Mr. Xi. For the collective cases discovered in Xinfadi wholesale market, people have been worried. We hope for a better day coming to us in earlier fashion. So for those close contacts, particularly those residing in the high-risk areas, and like us common people, how can we adjust our mentality to adapt to this new situation? That's a very good question. For the general public, we must also have our health checked frequently, and we offer different intervention measures from those patients. There are 3 different populations. One is those people living in the areas with close contacts. Second category belongs to the residents living in the high-risk districts. And finally, the third category, the common people. For those people who are the close contacts of the quarantine sites, we have a special organ dispatching the professionals of psychology and social work and other disciplines. They form such a team, and that team will provide psychological intervention to those close contacts living in the quarantine sites if they have any emotional fluctuation, like when they are feeling down or anxiety or they're having insomnia. We recommend those people to visit our website for more counseling. We will also offer them the hotline. That is a special hotline for coronavirus. So we encourage them to seek such professional help when they find them in difficulties. For the second category, living in the risky areas, we also have our mental help to those residents, especially the community or village committee will play a big role. For the residents living in those high-risk communities, they take a strategy of people-orientedness to offer the civil social work to them and to guarantee their daily lives. We will have some promotion and educational campaigns. We encourage them to join the WeChat group account and to seek help voluntarily. And finally, the self-management of the mentality among the common people. I think our common people must get immediate information about the epidemic and attach importance to the self-protection. If they have any confusions about those information, they must not just spread out the rumors, and instead they should resort to the experts to avoid to fall into the panic. And the second recommendation is for the general public to build their sense of responsibility as a civilian in the capital city. They must coordinate with the government agencies in epidemic prevention and control measure implementation. My third recommendation is to encourage the civilians to have a normal lifestyle and habit. They must adapt to quickly themselves to the environmental change under this new epidemic. They should take a rational attitude towards this epidemic and its impacts, and pay more attention to the positive sides of this new situation while building their confidence and their incentive. Finally, the civilians must have a good diet and a nutritious diet. They must guarantee 7 to 9 hours of sleep per day and have some exercise every day. With a good mood, they could build their immune capacity. If we feel that we are going astray in our emotion or our physical conditions, they could dial the number of 010-5830-3286. They could also go to the Anjing Hospital app to get professional psychological services. They may also inform their family members or friends about their abnormalities in their minds to get more help. So that's the end of this press conference, and the 143rd conference has been held by Qianlong website, 首都之窗, Beijing Daily, Xinjing newspaper, Beijing Youth newspaper, Beijing Toutiao, Beijing Time, People's Daily, Beijing Channel, News Agency, News agency Beijing channel, CCTV, APP, and CCTV financial channel, China Daily, Sinoblog, and China.com for live streaming. Beijing Transportation Radio, Beijing News Radio will also be live broadcasting this show, and Beijing News channel as well. So thank you all our media friends, thanks all the staff members. This is the end of today's show. Thank you for watching.